I think it's really important that I talk to you about what the World Health Organization says and what the New York Times says and Cornell University says and what Mr. Fauci says. And I think you will see the significance of that as I get into today's information, which has to do with PCR testing. So the World Health, and I'll just start with the World Health Organization, has officially acknowledged that what has been considered the gold standard test has a high rate of false positives that make it a bit unreliable. Well, in an advisory to lab workers that was issued on January 13th, the World Health Organization recommends a second test to confirm any diagnosis for people who show no symptoms of the disease. And the quote from the actual guidance is, quote, where test results do not correspond with clinical presentation, the new specimen should be taken. The World Health Organization warns that most PCR tests, quote, are indicated as an aid for diagnosis. That's a very important distinction from what has been going on. Indicated as an aid for diagnosis, meaning healthcare providers should consider at least 7 other factors to confirm any test. They, quote, must consider any result in combination with timing of sampling, specimen type, test specifics, clinical observations, patient history, confirmed status of any contacts, and epidemiological information. End of quote. That is a quote from the World Health Organization. This means that the tests administered at drugstores and testing facilities to people seeking medical care and so on are essentially meaningless because most people getting these tests are asymptomatic. There's no reason to get a test in the first place. And the people administering the tests are just administering the test. They're not really examining these people to determine their state of health. And again, this is from the World Health Organization. A study released last April from researchers from Cornell University and University of Hawaii found that evidence shows that false positive PCR tests are common enough to impact clinical and policy decisions. In August, the New York Times examined PCR testing data in 3 states and found that up to 90% of people testing positive carried barely any virus and therefore were not infectious. Experts who spoke to the Times and were quoted in the article said they couldn't understand why these were classified as anything, all right? Quote, some of the nation's leading public health experts are raising a new concern in the endless debate over coronavirus testing in the United States. The standard tests are diagnosing huge numbers of people who may be carrying relatively insignificant amounts of the virus. Now, in addition to this, I covered another New York Times study that went back several years that was covering an episode at Dartmouth University Medical Center in which 1,400 roughly people were tested using PCR when they thought that there was a whooping cough epidemic at the center. And the error rate for the PCR test at that particular time for that group of people was 100% error rate, okay? Mr. Fauci has admitted this as much. And I covered this in an article, I believe, in the newsletter. Remember, the Forbidden newsletter goes out on Monday and the Forbidden videos are posted at wellnessforumhealth.com. But basically, just to put Mr. Fauci's statements into context, the issue with PCR tests is the cycle threshold that you use. The test multiplies a fragment of whatever it is that you're trying to amplify over a series of cycles until it can detect a virus within the sample. And the more cycles needed to detect the virus, the smaller and weaker the original sample was, which means that if you're running at the test at high cycle numbers, you may be taking fragments of nothingness and blowing it up into something, all right? So he acknowledged this, Fauci acknowledged this in a July podcast interview that in December, actually, that I think it was in July of last year. At 35 cycles or higher, the chance of the test being accurate are minuscule. This is according to Mr. Fauci. Quote, it's very frustrating for the patients as well as for the physicians, Fauci said. When somebody comes in and they repeat the PCR and it's like a 37 cycle threshold, but you almost never can culture virus from 37 threshold cycle. So to continue his quote, I think if somebody does come in with 37, 38, even 36, you got to say, you know, it's just dead nucleotides, period. He pointed out that patients usually are not told their cycle threshold after testing positive, and he also failed to point out when he was interviewed that the instruction manuals issued by the government and all were to run at 40 cycles, and by many of the manufacturers were to run as high as 45 cycles. An external peer review concluded that a major paper supporting PCR for COVID-19 had 10 serious flaws, and I also covered that in, I believe, either one of the forbidden videos or in the forbidden newsletter. It's ridiculous we have to do that stuff, but anyway, in the peer review of this, the critics wrote, "We are confronted with stringent lockdowns which have destroyed many people's lives and livelihoods, limited access to education, and these imposed restrictions by governments around the world are a direct attack on people's basic rights and their personal freedoms, resulting in collateral damage for entire economies on a global scale." And again, if the test was accurate, this would all be warranted. But what I'm telling you, the World Health Organization is now basically saying that we should be concerned about all of this. A briefing published in Britain concluded that PCR testing is, quote, distorting policy and creating the illusion we're in a serious pandemic when we're not. A false positive pseudo-epidemic is a well-described phenomenon in the medical literature which results in an exponential rise in diagnosed cases and deaths, but no excess deaths, the researchers wrote. Nevertheless, the high threshold tests are continuing to be used. A physician from Omaha, Nebraska testified to the Papillon, Nebraska City Council on December 1st. We're basing all of these lockdowns, these restrictions, these mandates on faulty testings. In other words, he said, we don't have a pandemic of people falling over dead. What we have is a pandemic of false positives. He explained that it was not meant to be a diagnostic test, and that's what Carrie Mullis, the developer of PCR, said. It's not designed to be a diagnostic test. Anyone can test positive for practically anything with a PCR test. If you run it long enough, you can find almost anything in anybody. It doesn't tell you that you're sick. So again, this information is from the World Health Organization. This information is from the New York Times, the places that everybody is getting their information to justify what's going on. So I'm hoping that some of the people who still believe that we are in the midst of a dangerous pandemic will check these resources out and maybe join our side of the fight at this point in time. All right, that's all for today. As usual, I'll pass this on to anybody who you think might enjoy watching it, and I'll be back to you tomorrow with more news.